Hello, I'm Lila Wright Contreras.
And I'm Mario Sol. In this chapter, we will talk about illegal drugs that our children can buy at school, parties, clubs, gyms, and even our own streets.
We will start with the objectives of this chapter. Recognize the most commonly used drugs by Latino teenagers. Recognize the warning signs that indicate drug use. Understand the physical and mental effects of different drugs.
Did you know that 5 out of every 100 parents think their children have had opportunities to use drugs?
But 69 out of every 100 teenagers say they have had the opportunity to use drugs.
It is difficult to understand why our children use drugs, but we know that certain factors contribute to their use of illegal substances. A survey of teenagers conducted by the National Center on Addiction and Substance Abuse, CASA, found that stress, frequent boredom, and more than $25 weekly spending money raises the risk of teenagers smoking, drinking, getting drunk, and using illegal drugs.
Now, we're going to discuss one of the more frequently used illegal drugs in this country, and one that many Latino youth are abusing: marijuana.
This is a pattern among the majority of adolescents in the United States for whom 13 is the average age they start using marijuana.
There are more than 200 words to describe marijuana. In Spanish, some of the most common words are the following: mota, hierba, mafu, pasto, María, monte, moy, café. There are a lot of terms in English as well: pot, herb, grass, weed, Mary Jane, reefer, skunk, boom, gangster, keef, ganja. Marijuana is a mixture of leaves, stems, seeds, and flowers. It usually is rolled into a cigarette or smoked in pipes. The color of the mixture can be brown or gray. Attention parents, the marijuana available today is stronger than it used to be. It contains more than 400 additional chemicals that can be harmful to our health.
The reason marijuana is considered a gateway drug is that the majority of individuals who take hard drugs like cocaine or heroin start by smoking marijuana.
Some of the long-term and short-term health consequences of marijuana use are difficulty in studying and learning, hindered athletic ability due to affected reflexes, movement, and coordination, loss of short-term memory, such as recent events, problems trying to do complex assignments, delayed perceptions and reflexes. This can cause traffic accidents, high risk of having unprotected and dangerous sex, risk of getting HIV or the AIDS virus.
As we mentioned in previous chapters, it is important to be aware of changes in our children's behavior. If they are using marijuana, they might behave in the following ways: become dizzy and have difficulty in walking, act dumb and laugh for no apparent reason, have red and irritated eyes, have trouble remembering recent events, feel tired and sleepy.
One of the most important things for parents who suspect their children are smoking marijuana is to talk honestly with them. I recommend that parents ask their children directly, in a way that does not make them feel defensive, and in a way that lets them feel comfortable telling the truth without fear of being punished.
Here are some things that can indicate the use of marijuana: pipes, rolling papers, odor on clothing and in bedrooms, the use of incense or air fresheners, the use of eye drops, clothes, posters, jewelry, etc. that promote the use of drugs. If you think your child might be using drugs, there are medical tests that can detect the marijuana use.